Hello, welcome to the Healthy Alternatives podcast. I am Dr. Christine Sauer with DocChristine.com. Today's show is a recording of my radio show of the same name. Enjoy! Good afternoon, this is Dr. Christine Sauer, your host of the show Healthy Alternatives, here on 97.5 CIOE-FM with live stream on communityradio.ca every Thursday at 12 noon Atlantic Standard Time. Thanks for tuning in today. In this show, I will talk mostly with guests about all aspects of health, healthcare and wellness, from conventional to alternative and everything in between. My mission for this radio show is to help change people's lives for the better by informing them about different options to get and stay healthy and well so they can choose for themselves which option might work in their case. And if you feel you are stuck in a dark place, I want to tell you, don't give up. There is a light at the end of the tunnel for you too. For those who don't know me, I'm the founder of DocChristine.com and a German-trained conventional as well as naturopathic physician. At Doc Christine, we specialize in addressing the physical root causes of mental and brain health issues. And I'm often asked to give a bit more in-depth information about different health topics, so I'm happy to do that. So today, my team member, Jennifer Gauguin, a certified integrative nutrition health coach on my team, and I will be talking about what could be causing your mental and brain health issues that you never thought possible.
That's a good one.
That's a real good one. And I love to talk about that topic because I remember when I was really depressed and I was suicidal, went to the emergency room. Mm-hmm. What did they do? They slapped a label on me, major depression.
Gave you some pills.
Gave me pills, put me in a safe place, locked me up, which I needed at that point.
Right.
And waited. That was it.
That's right.
And when
those medications take about 6 weeks.
Yeah.
They can, some
And
do.
after 2 weeks, after I didn't get much better, they increased the dosage.
Of course.
So that's what they do. And eventually, after I was discharged after 4 weeks, stable enough to at least go home. I was transitioned to a counseling program, stay hospital program, excellent program. But the thing is, all I got from it was a little counseling, which helped a little, and medication, which helped some too.
Right.
But over the next 10 years, I had ups and downs, and I was struggling and in a downhill spiral, and all the medication didn't help fully.
So
they helped some.
Exactly.
So then I thought by myself, hey, there's something there that I can change.
Yes.
And I think everybody has to come to that point where they make a decision that can't be how the rest of my life should look.
Right. Medication is, I have nothing against medication. No. I think it's good. It's a good starting point.
Yes.
And it's good to get you back on your feet, get you, kind of back to where you were before you got sick.
Absolutely.
But then once you're feeling better, take some time and get to the root of it. And because sometimes there are root problems. And we'll get to that.
Yeah, and that's what we are addressing now. And that is something that we do all the time.
That's right.
We talk to clients and find out what are their symptoms. And yes, a diagnosis is often a starting point. And it's sometimes actually a valid diagnosis.
Definitely.
Sometimes somebody that has breast cancer has breast cancer.
That's right.
Yes, the root causes may be different, but I value modern medicine that does a nice surgery in anesthesia instead of just waiting until it's so bad that they just cut it off.
Exactly.
And so modern medicine has many, many advances, and I value that. And I'm not against it at all. I still take medication, and it stabilizes me. At least my psychiatrist thinks that. But
jury's still out.
Jury's still out. I still have the plan when I'm 60 to start slowing it down.
Okay.
Give him enough time to learn enough about what I'm doing.
For sure.
And what we do now is do the aim for brain health approach.
Exactly.
And that is something that is not done anywhere here locally. Or
it's not.
In Canada, in the States, there's a few doctors doing it, and that's amazing. The more do it, the better it is. And I call it the aim for brain health approach,
right,
because the A stands for assessment. And that's the starting point.
Exactly.
We have to find out what all is going on and how can it be connected. People don't know how many of their symptoms could be connected.
Oh my gosh, there's so many different things.
Yeah.
Like even, well, gut health for one thing. So, I mean, you could have a lot of toxins in your
there's
body
tons
and
of
not realize.
things. And of course, I read all the books on that topic that I could get, and it helped a lot. And I took those tests, and they showed not only was I toxic, but I had inflammation, I didn't exercise, I had stress.
Exactly.
My gut was a mess, and I had infections with Candida albicans, which is a bad yeast. There's a good yeast and a bad yeast. They're both called Candida, so don't blame Candida on everything.
That's right.
Our baker's yeast is Candida robusta, and they taste pretty decent. There can be nutrient deficiencies. Those are rampant.
Oh, my gosh. Vitamins, minerals. Oh,
And I see it so often when I do the testing.
That's right.
And that it comes back, trace mineral deficiency, vitamin C deficiency, vitamin D deficiency, magnesium
shows
deficiency.
Up a lot.
And
calcium.
Of course, there's reasons for that. And I was talking about that before in that show.
That's right.
And some of it is the environmental toxins that get heaped onto up, and it may be even a major reason.
We love talking about those.
Absolutely. And I still remember talking with Michael Palmer about glyphosate and him enlightening me about that it was originally meant to become an antibiotic.
Right,
but it was
I
too
forgot
toxic
about that.
to use as an antibiotic. So somebody had the interesting idea to spray it on food crops.
Yeah, that's awesome.
Yeah, it's too toxic for people to ingest, so put it on the foods they eat.
Exactly. Then they only get a little bit of it.
And a little bit is harmless, isn't it?
Oh, yeah. It doesn't build up over time or anything.
No, and especially with all the other stuff that's in it.
Oh, my goodness. Exactly. And the stuff that's missing.
I feel really that we have a perfect storm of toxins.
Definitely.
And I like to quote Dale Bredesen, who wrote an amazing book, The End of Alzheimer's. And he's the first that actually developed a program to not only prevent, but also reverse early dementia. And he statistically did that, and he scientifically published his results in a peer-reviewed study and showed that 9 out of 10 of his patients that actually did the program, which is quite complex, got better.
So what are we missing? Like, what's our...
He says there's 3 main causes of dementia and probably all other chronic illnesses that just go and don't get better.
Okay.
Number 1, toxins.
Yep.
Number 2, inflammation and infections.
Okay.
Number 3, nutrient deficiencies.
Wow.
And all 3 of them can work together as a perfect storm.
For sure. So basically, just to kind of sum up what you're saying, is that majority of us probably have toxins in our system.
All of us.
All
Even
of us.
newborn babies
true.
have toxins.
That's true, coming from the mother. So toxins, inflammation, which we would all have on some level, some more severe than others.
Well, a certain level of inflammation is normal.
Okay.
The body needs inflammation to get rid of, for example, pathogens.
Okay.
When you cut yourself and the wound is a little infected, it gets red, that's the inflammation.
Okay.
And then the body deals with the infection, and the redness and the inflammation goes away.
Okay. So
that's normal inflammation.
We need. Exactly.
But when the body is unable to regulate it anymore, and there's many causes that can cause inflammation, and that's a fascinating topic by itself.
Right.
And when the body is unable to regulate that, then the inflammation gets more and more and more. And then at first you feel some fatigue or brain fog. I actually had a little video on my YouTube about the 4 stages of inflammation.
Okay, yep.
Where I described how from a little bit inflammation, you progress to severe inflammation where you have an autoimmune disease and really have to do something about it to get the root causes away, and you may be able to reverse it. You may not. It depends.
That's right.
But at least you get it better. And we've both seen clients that were diagnosed with morbus Crohn get so much better after we found out what the root causes and address it.
And the last one you said was the vitamin and mineral deficiencies.
And I said nutrient. Because it's not just vitamin, mineral. We need phytochemicals. And many people are also amino acid deficient because they eat junk food and it's not a full protein, or they're not able to absorb it. And many people have an omega-3, 6 imbalance.
For sure.
And we test for that too, to help them find out how much of the omega-3 supplement, if any, they need.
So basically, these three things are so common, and they're something that the majority of the population would have. So it's just crazy to me that nothing is really being done, like with our healthcare system. They're not getting to the bottom of things. They're not looking at your toxic levels and your minerals and inflammation.
No, not really. And that's a sad thing because it could be so much better. And modern medicine does a lot. But the medical schools are mostly financed by certain interest groups. I won't name names. I don't want to get into politics, but it plays a big role in that.
Right, it does.
Well, I think this brings us to the end of the first half of today's broadcast here on 97.5 CIOE-FM Community Radio. And please tune in after the commercial break, where Jennifer and I will be talking a little bit about my barrel model for disease and what it means and why certain people get sick early and others never. Thank you. Hello and welcome back to Healthy Alternatives here on 97.5 CIOE-FM or on the web at communityradio.ca. I'm your host, Dr. Christine Sauer, and today my fellow health coach, Jennifer Gauguin, and I are talking about physical root causes of mental and brain health issues that are often overlooked or not even known.
That's right.
And it is mind-boggling what all can cause it. And we talked about the three most common causes before. And now many people ask, but why does my child have eczema, whereas my neighbor, he smoked and drank it all his life and ate junk and had stress and everything, and he is 100 years old and couldn't be healthier?
You know what? That kind of sounds my grandfather, who's passed away now for a few years, but he was, oh gosh, I forget his exact age, but he was around 90 or 91 or 92, and he smoked probably from the time he was about, 13 or 14. It was really young. I mean, it was a long time ago. Yeah. And he was as healthy as anything.
And there's a good explanation for that. Mm-hmm. And I explain it with my barrel model of disease.
Right.
Now, that is a nice, for me, I find it funny.
Yeah.
It explains exactly that. And of course, it is it comes together, the genes and the environment.
Okay.
Because, in my opinion, everybody is born, say, with a barrel of a different size. And there's people that are born with a small barrel, with a small spout to drain it, and there's people that are born with a large barrel with a large spout to drain it.
Okay.
And then all the environmental influences fill our barrel. So that would be the toxins, the malabsorption, the nutrient deficiencies, the inflammation, the infections, the smoking, the medications, the toxic thoughts, relationship issues, stress, all that is filling our barrel.
Right.
And it has to be in balance between what's going in and what's going out.
Okay.
Or else the barrel is slowly filling up.
So some people are better at, their systems are better at getting
detoxifying.
Rid. Yes, exactly.
And the spout to get rid of all that is really represented, the spout represents the detoxification systems of our body that are often neglected, which are liver. Bowel, kidneys, lungs, and skin.
Okay.
The skin is a very important detoxification organ. If you sweat, you get rid of all kinds of toxins. You need to wash it off with water afterwards. And I always say when somebody has a big spout, even if it's big, he can get sick because it can get clogged. The detoxification system may lack the nutrients to function.
Makes
all
sense.
Those enzymes that the body needs to make toxins harmless need cofactors, vitamins, minerals, phytochemicals. If they are not present, it doesn't work.
Then it starts to build up.
Right, and that's when it happens that the barrel slowly fills up. And while the barrel fills up, you feel great. You have no complaints. You can't see anything on the outside. But it's well known that, for example, Alzheimer's dementia starts, you can see it in brain scans 30 years before you have symptoms.
Wow. I didn't realize it was that long.
Oh,
30.
yes.
Okay.
Dr. Amen, who certified me, showed it in a SPECT scan. He can show it earlier.
Wow.
And that's the barrel filling up. And one day, when the barrel is full, the drops, it starts to overflow.
And then that's the symptoms.
That's when we get symptoms. And sometimes I'm a little cynical and say, what does conventional medicine do? It takes a mop and mops up the spill.
Yes.
That's the symptomatic treatment.
Yep. It's a Band-Aid solution.
You mop up. It's a Band-Aid solution. And you need to support the spout so it can drain better. And you need to remove the rain that's going in the barrel.
Right.
And the worse your situation and the younger you get it, the more you have to focus on it.
That's right.
So I think that's my theory. Of course, there can be sudden events that poke a hole in your barrel and make it overflow.
Well, that's true. But it makes sense, though, because people, I'll use myself for an example. I grew up eating a lot of dairy. I loved milk, loved cheese, yogurt, all that kind of stuff. And I didn't think that I had any problem processing it or... And then all of a sudden, about 5 years ago, I guess, when I did some testing, I found out that I was intolerant to it, and my husband the same thing. And we both kind of thought, well, why now? We both ate this for our whole life, so what changed? I guess to make all of a sudden this intolerance, and that's the whole thing. Like, it was just building up and building up and building up.
That's one thing. And my theory of how those sensitivities appear is when the gut is not fully functional, is leaky, which they are from toxins and medications.
Right.
And when the gut is leaky, bigger proteins that usually don't reach the immune system suddenly can get through. Okay. And then your body says, what is this? I haven't seen that before. I better react to it. And there you go.
Right.
And it's great to find it early because it causes a slow festering inflammation.
That's right.
And I call it the dragon of inflammation that bites you.
That's right.
Because you don't know it. And as you said, the barrel is filling.
Yeah.
Until it overflows, and then you get diagnosed with something.
So it's the same philosophy as like the straw that broke the camel's back. Same.
Same idea. Just for some reason, how do you illustrate the straw?
Yeah, exactly. The barrel makes much more sense.
Yeah, I mean,
visually.
yes, you can pack the camel fuller and fuller over time,
I guess.
and then one straw more, and the camel breaks down. But maybe you should train the camel better.
Yeah, exactly. No, yours makes much more sense.
I like the barrel model. It's actually taken from a German saying, which is equivalent to the straw that broke the camel's back.
Okay.
Der Tropfen, der das Fass zum Überlaufen bringt. The drop that made the barrel overflow.
Okay.
That's what the Germans say when the English mean the camel's back.
Right. Gotcha.
So that's a funny thing in linguistic too, and I enjoy those little a little fun. The same when somebody like me that has a German background hears the English saying it's raining cats and dogs.
Right.
I see the cats and dogs falling on the floor, and I say, oh my God, the poor cats, the poor dogs.
Really doesn't make any sense.
No, and you don't even think about it.
No, that's right.
And in German we say it's raining out of buckets.
Okay, that makes more sense than cats
Makes more
and
sense,
dogs.
but where do the buckets come?
Yeah,
so that doesn't make any sense either. But it's funny how different languages use different images.
Exactly. I know, that is funny. So basically, our like going forward, it's for anyone out there that's listening that has kids. It's so important. And I'm trying to take my own advice here with my own kids, but to implement some of these changes early with your kids, like with healthy eating, exercise, less medications if possible.
If possible. I mean, certain medications are just necessary, but there should be a protocol.
Sure.
For example, if your kid needs an antibiotic, and it happens, of course, then afterwards there should be a gut restoration protocol.
Exactly.
With the right probiotics in the right dosage.
That's right.
And then followed by a healthy food diet, which is lots of vegetables, which is hard to get into kids.
It is. It is.
You know that
it's
as a
daily
mother.
struggle.
I hear you. It's even a daily struggle to get it into adults.
It can be. Yeah. If you don't like it, I guess it would be hard, but...
Well, as an adult, you have hopefully enough insight that you say, okay, my taste buds change over time.
Exactly.
And I think for kids, it's very important to have the parents model it.
Yes.
You can't talk to your kid and say, you eat that broccoli. Or,
right.
But
and then
I don't
like
like it.
Yeah, I know. That doesn't make any sense.
I don't like broccoli, but you should eat it. That's like a doctor smoking, telling the patient, don't smoke.
Exactly.
And I had that happen to me. I wasn't smoking, but he was smoking in front of me, and that didn't make a good impression to me.
No.
That was long ago, when it still was okay to smoke in an office.
It's hard to believe that that
even
stuff
when
existed.
I mean, I'm getting old, and I remember when I was on an exchange to friends, the teacher sat on the piano, music teacher, and smoked in class.
Oh my gosh.
That was accepted practice in 1976. So now I gave away how old I am. But really, you get not older, you get younger over time.
You do.
Yeah. Don't get older, get younger. And
that's right.
As I said, the senior moments is not your fate. Dementia is not necessarily your fate. You can reduce
not with
your
what
risk.
We know now.
You can reduce your risk. You can sometimes reverse it. I won't say you can heal it. I'm not saying that.
No.
And nobody can heal anything, because there's a God or the spiritual entity to believe it.
That's right.
That you heal. But there's consultants like us doctors and health coaches that can help. But the client always is a boss, is in the driver's seat.
That's right.
But your body is like a car, and your car needs tune-ups.
Exactly.
Do you give your body a tune-up every now and then, or a general overhaul? Or do you wait until it breaks down and you go to the doctor and...
That's typically what happens, I think.
Put a spare part in. That's what typically happens. And
you really have to take your health into your own hands, and you're your own best advocate.
And I mean, whether you're religious or not, the Bible has a lot of truths, and one of them is the body is your temple.
That's right.
Take good care of it. It's the only thing you have.
Yep, exactly.
And if that breaks down...
You don't have your health, you don't have anything.
No, that's right. And that's a wonderful point to bring us to the end of today's show. Thank you so much, Jen,
no problem.
being on the show, being a good sport. And please don't hesitate to contact us with any questions, thoughts, comments, or suggestions. My email here is christine@communityradio.ca, or contact me through our website, docchristine.com. And I'm always grateful for feedback. I also want to extend a special thank you to today's producer, Jim Francis, and Murray Stacy. Thank you, guys. You might not know this, but this is a volunteer-run non-profit radio station. And we even have an art gallery. If you're local and you'd like to drop in, we are at 11 Glendale Avenue, Lower Sackville, Nova Scotia. Thank you all for listening to Healthy Alternatives. I'm your host, Dr. Christine Sauer. Tune in next Thursday at noon on 97.5 CIOE FM Community Radio with live stream on communityradio.ca for the next episode. Goodbye and have a great day.